Yes, sir. With your election into the committee, actually for both of you, you're both going to be hoisting up the Parul University flag. So I think we would actually like to find out how your association with the Microbiology Society of the UK is actually going to impact Parul University.
Well, as you rightly mentioned a while ago, we are currently amongst the only Indians from India who are serving onto the core committees of this society. Now, we are very proud to be associated with Parul University, being the member of this society. What does that mean for university is, we bring our university to an international repute. Across all the members and committees of the society, now there is a distinct recognition of Parul University. It also implies that Parul universities have people on board who continue to represent such international societies. What we bring back to Parul University is more and more international collaborations, more research avenues, more opportunities for our students from all the different parts of the world to be a member of this society and to benefit from all the initiatives that the society takes and to contribute and be a leader in cutting-edge research in microbiology.
Welcome to another segment, and with us today we have not one but two esteemed guests in the persons of Dr. Hemant Patadiya, who is the principal of the Parul Institute of Paramedical and Health Sciences, and along with him we have Miss Ankita Priyadarshini, who is an assistant professor at the aforementioned institute. Sir, ma'am, thank you for joining us today.
Thank you for having us, Peter.
I'm sure you must have heard this very phrase quite a lot over the previous months, in which people are saying congratulations. And the reasons behind this particular congratulations is the fact that you have been elected into the core committee of the Microbiology Society of the UK. So once again, from our side, we would like to say congratulations.
Thank you.
So for me personally, I must have done the research, obviously, to have to interview you in regards to what this society is all about. However, from your perspective and as members of the society, I would like to find out what exactly is the Microbiology Society and what is its core mission?
So the Microbiology Society of UK is one of the oldest societies formed around the world, which serves the field of microbiology. The society was founded in the year 1945 with Sir Alexander Fleming, the first discoverer of the antibiotic penicillin, as its president-elect. The society comprises of various organizations such as schools, colleges, universities, research institutions, industries, academic bodies, and non-governmental organizations such as various NGOs, and people from different walks of life as its member. The society's core vision and mission is the advancement of the field of microbiology. The society wants to harness the power of microorganisms for the well-being of humanity, as well as it wants to prevent humanity from any threats the microorganisms possess. The society also wants to work as a dynamic force which advances the knowledge of microbiology around the globe. It is backed by people from all walks of life and is now also trying to cover as many nationalities as possible, with thousands of members spread around different parts of the world. And we are happy to be elected into its core committee. Thank you.
You have mentioned that the society basically has gotten people from all walks of life and all nationalities. And presently, you both are the only two Indians from India that have been elected into its core committee. However, looking at or studying the society, I've figured out that it has its own structure, which means there are different committees. So I would like to find out which committees have you both been elected into, and in those committees, what would be your roles and responsibilities?
Sure. I think maybe you would answer that first.
Thank you, Peter, for such a warm welcome. I'm being elected in the Building Community Committee. As a member of the committee, my role involves fostering collaborations internationally, establish partnership across borders, and try to increase the footprints of Indian scientists and members in the society. And I also look forward to bring diversity and inclusivity from the underrepresented nations.
Thank you. And sir?
Well, so I have been elected into the Audit Risk and Evaluation Committee. Now, as a member elect of this committee, my role will primarily be to ensure financial transparency, to ensure financial security, to promote and continue society's functioning in a sustainable manner. I'll be collaborating and working with external auditors, with the committee members in close proximity, and will ensure that all the risks are measured in advance. We deploy all the risk mitigation strategies in advance, and we ensure that the society meets its strategic objectives year on year. Thank you.
Yes, sir. So, with your election into the committee, actually for both of you, you're both going to be hoisting up the Parul University flag.
Yes.
So, I think we would actually like to find out how your association with the Microbiology Society of the UK is actually going to impact Parul University.
Well, as you rightly mentioned a while ago, we are currently amongst the only Indians from India who are serving onto the core committees of this society. Now, we are very proud to be associated with Parul University, being the member of this society. What does that mean for university is, we bring our university to an international repute. Across all the members and committees of the society, now there is a distinct recognition of Parul University. It also implies that Parul universities have people on board who continue to represent such international societies. What we bring back to Parul University is more and more international collaborations, more research avenues, more opportunities for our students from all the different parts of the world to be a member of this society and to benefit from all the initiatives that the society takes, and to contribute and be a leader in cutting-edge research in microbiology.
So presently, going through the website of the Microbiology Society, there has been mention of a very big project known as the Knockout AMR project. Could you shed a little bit more light on what that is and why it's important for us?
Nowadays, antibiotics are being overused, and that has led to antimicrobial resistance, and this could be a next global pandemic. The society has built a consortium where members and scientists across the world will come together and work on this project. My role involves conducting research in the Indian population. India, with its healthcare challenges and population dynamics, it serves as a ground to understand and tackle antimicrobial resistance.
So, just to avoid this misconception, because a lot of people sometimes believe that by being a part of a committee or any of these international organizations, you might not be doing anything there. But so to clear up the doubts of anybody that might have a doubt, I would like to know two things. Essentially, what are your research areas and how will your research areas contribute to the society at large?
Well, I think I can answer that first. And my research area basically focuses on varied domains of health sciences. So I come from a background of microbiology. Then I have got a formal training into immunology. Then I have worked in an area of disease biology where development of various forms of disease models in vitro was one of my expertise. Currently, my research area focuses also into the domains and forays of microbial genetics and genomics. My research specifically involves looking into the clinical representation of antimicrobial resistance. We want to look how the influence of different healthcare settings in a primary care health facility versus a secondary care or a tertiary care or super specialized healthcare facility affects the spread and containment of antimicrobial resistance. I'm also interested in looking what all policy measures can we devise and develop to prevent massive spread of antimicrobial resistance and have effective antimicrobial stewardship programs. I would also be interested in understanding the genetic makeup of the pathogens which are found specifically infecting the Indian subpopulation. because most of the targeted therapies developed around the world does not have a major representation of Indian population during their clinical trials, and therefore many drugs developed in the Western countries do not work for Indian patients. Hence, my primary interest looking into the near future being a part of the knockout AMR community would be to have research which is specifically contextualized for Indian population.
Okay.
I think you can go next.
Yes. My research focuses basically on clinical microbiology, epidemiology, disease biology, and more emphasis on the microbial community characterization, specifically in urinary tract infection, and studying the AMR pattern, antimicrobial resistance pattern of those uropathogens.
Okay.
I am also currently working on the antimicrobial resistance pattern with a gender-based perspective, with a geographical variation, and along with the underlying comorbid conditions. We are also developing nanoparticle-based coating that can be useful for the patients who are using catheters. Another project involves the development of point-of-care device that helps to screen the antibiotic sensitivity test and reduces the time of result that a manual AST test takes. With the advancement of technology, we are also incorporating artificial intelligence that can develop prediction models which help in the disease prevalence and give a better empirical treatment for the individual. Thank you.
Both of you seem to have quite impressive resumes, especially in your fields of study. However, now that we have you here, sir, as the principal of your department, we have students, those that might have a slight interest, and we've been speaking about microbiology this whole time. So I would like to understand from your perspective, especially as a principal, what is microbiology, why should we care about it, and why do we need people to focus more on this?
I think that's very, very interesting and fundamental question that you asked, Peter. And not just as a principal, but I would also say that as a layman, why somebody should be interested in microbiology. I'm sure we have all not forgotten the havoc the COVID-19 pandemic has laid out in front of us.
Yeah.
Countless lives were lost. Nobody knew how to manage this epidemic. Nobody knew how to fight with this virus. Nobody knew how to develop better medication and vaccines to combat this pandemic. Now that's just one glimpse of how dangerous our ignorance and lack of knowledge or careless attitude about microbiology could be. So irrespective of whether you are a student of allied health sciences, basic sciences, of any field related to medical sciences, or not even from science background at all, but you are undoubtedly surrounded by microorganisms around you. Now, on one hand, the world talks about leveraging the benefits that the microorganisms can give us for advancement of humanity, for better health, for development of industrial products, so on and so forth. But on the other hand, we should also be aware about the challenges that lie in front of us. One such challenge was mentioned as the global antimicrobial resistance pandemic. Now, as you rightly asked, there could be an age, there could be a time where none of the antibiotics work, and that could be potentially affecting everyone amongst us, right? So as individuals, I believe everybody does have a role to play, should develop a keen interest and vigilance about microbiology. We as administrators of an institution, me as a principal of this institution, my primary focus and interest would be to bring what all the world is doing in the foray and in the domain of microbiology, where the world is heading in cutting edge research, and how we can bridge that gap between students who belong to LMICs, which are low and middle income countries, because there are many such students who come from LMICs into our institution, and even for students who are from developing nations such as India. right? So from my perspective, I believe microbiology holds paramount importance in each of our lives. And whether we want or not, we cannot ignore the advancements that the microbiology community is going to do for the near future. And being a member of this society, I think we should be amongst the pioneers of Parul University to take the university and its community towards that future.
Very true, sir, because in my situation, I was actually one of the victims of COVID-19. I actually got infected, and that uncertainty the world was in I think it actually doubled the effects of the COVID-19 upon anybody, because there's nothing worse than the fear of the unknown.
Yes.
Especially how it was turning the world upside down. But we've spoken about research essentially. However, as your last question, do you believe that we as Parul University have the necessary tools, labs, and research material in order to actually enhance the research on microbiology?
Yeah, I strongly believe we certainly do have that capacity. The capacity in terms of human resources, we have amongst some of the sharpest minds across the campus. The capacity in terms of interdisciplinary collaborations, we have different domains, expertise and knowledge available within our Parul University. We have people from engineering background, we have people from programming background, we have people who are into policy making, from law background, we have people who are public health professionals, epidemiologists, we have people who belong to medicine, allied health professions, basic sciences, pharmacy and such. So I think in terms of human resources, we definitely have that capacity. We just need to pull them together, find common goals and interests, and leverage each other's competencies to overcome the individual shortcomings. In terms of the infrastructural facility, I think Parul University has done a tremendous amount of growth over the past 2 to 3 years. And I would not just say because I am a member of Parul University, but I also say that being a member of this Microbiology Society UK, I see that now we have instruments and resources which can help us fuel into cutting edge research and technological advancements. So I think we definitely have the potential to do great research. And I think being a member of the Microbiology Society, we can help bridge the gap between the researchers of Parul University, the students, the aspirant researchers of the future, as well as the people from the West and other parts of the world.
Well, I'm actually hoping for a future where we have more people passionate about microbiology as both of you are. And thank you so much for being a part of this particular segment. And we hope to see you here again next time.
Thank you so much.
Thank you, sir.
Pleasure. Thank you.
Thank you, ma'am.
Thank you.